makes a cell responsive to a particular hormone? What do you think? Put your answer in the comments section. Let me give you options. A, the chemical properties of the hormone, the presence of a receptor for that particular hormone, the location of a gland that secretes the hormone, the location of the target cells in the body, the site where the hormone is secreted. What do you think is the answer? Put it in the comment below. Okay, let me give you another question. The hypophyseal portal system connects the dash with the dash. A, posterior pituitary, hypothalamus, anterior pituitary, posterior pituitary, hypothalamus, thyroid, pituitary gland, thyroid, anterior pituitary, hypothalamus. Put your answer in the comment below. I'll give you another question. The infundibulum is a dash, a mass of endocrine and a neural cell, portal systems between the hypothalamus and the pituitary gland, bulky nucleus composed of a paraventricular nucleus and a supraoptic nucleus, depression of the sphenoid bone that protects the pituitary gland, projection of the hypothalamus from which the pituitary gland hangs. Can you attempt this question? Put your answer in the comment below. Okay, one more. The anterior pituitary is dash, the posterior pituitary, and has dash connection to the hypothalamus. A, smaller than, no neuronal. B, larger than, a neuronal. C, larger than, no neuronal. D, smaller than, a neuronal. E, similar in size to, no neuronal. Put your answer in the comment below. So you're welcome to my channel. Once again, I am Dr. Nchebe. I'm here today to discuss a rapid review of the endocrine system. The idea of this discuss is for you to, have everything at your fingertips as you're entering the exam hall. It can be your AP 1 and 2 finals. It can be the NCLEX exam. It can be USMLE. It can be MCAT. Any of these exams, you are welcome to use this video. Please, I want you to watch this video from beginning to ending. If I'm speaking too fast, calmly put it on a slow mode so that you'll be able to listen to me because I speak very fast. All right? And also, I'm trying so much so that this video will not exceed 1 hour so that it doesn't bore you out. All right? So today we are discussing the endocrine system, and I would like you to pay more than usual attention. Take your pen and paper and let's start. All right? We are discussing up to 100 questions on endocrinology. I will discuss some facts with you. Everything is all about concepts. All right? Take pen and paper and write down those questions. Write down the supposed answers. And after, think about them. So I will give an overview of endocrinology, then we'll jump into those questions as soon as possible. Mind you, this video does not cover for your classes. It doesn't cover for anything. It's just a rapid review. All right? Thank you so much. So let's go into the overview. The endocrine system composes of tissues, glands, and cells that secrete hormones. Why endocrinology is the study of this system. All right? Diagnosis and treatment of disorders. Now we have endocrine glands, we have hormones. Glands, organs that are traditional source of hormones. Why hormones are chemical messengers that are transmitted by the bloodstream and stimulate psychological responses in cells of another tissue or organ, often in a very long distance. This is an overview, the basic overview of endocrine. As you all know, the endocrine system has 4 major ways of communication. We have the hormones, which are chemical messengers that travel between blood systems to other tissues and organs. That's 1. 2, we have paracrine. Paracrines, they secreted into tissue fluids to affect nearby organs. So the difference between paracrine and hormones, the hormones go far. Why paracrines just nearby organs, all right? Now we have neurotransmitters. These ones, neuro, from the neurons, all right? They travel not in the blood, but along the synaptic cleft to the second cell. Then we have gap junctions. When you're talking about gap junctions, you are talking about pores. Pores, there are different mechanisms. Pores that allows signaling between molecules, nutrients, electrolytes from cell to cell. It's always hole in between 2 cells. That is what gap junction is. So remember, there are 4 because they will ask in your exam: gap junctions, neurotransmitters, paracrine, and hormones. If you look at the diagram on your slide, you will see, the different endocrine organs. You see the pineal gland, you see the hypothalamus, you see the pituitary, the thymus, the thyroid, the adrenals, and others, which we are still going to discuss one after the other. One thing you have to know is that exocrine glands, they have ducts. Endocrine glands, they don't have ducts. All right? Exocrine glands are always extracellular. They always have extracellular effects. That's why we call them external secretions. while endocrine glands internal secretions. There are some systems, some chemicals that function as both function as both hormones and neurotransmitters. Remember the examples: norepinephrine, dopamine, antidiuretic hormone. Norepinephrine, dopamine, antidiuretic hormone. These three are the examples that they will give you, and they will tell you one of the following is not, or one of the following serves only a unifunction. But this serves dual function. So they can be either hormones or neurotransmitters. Another thing you need to know is target organs or cells. These organs or cells that have receptors, all right, for a hormone and can respond to it. So when a hormone comes, it perches on that target and immediately there's a conformational change, all right? So some target cells possesses enzymes that convert a circulating hormone to its more active form. Bear this in mind. So the diagram, as you're seeing it, discusses the communication in the nervous system and also in the endocrine system. If you look closely, you will see that in the nervous system, right, there is neuronal interaction. This leads to nerve impulse moving along the axons. From there, it goes to the axon terminal, that's the junction, breaks open vesicles, which pours out neurotransmitters that has effect on the target organs. But if you're talking about the endocrine system, it deals with those organs pouring the hormones into the blood, and the blood will carry it straight up. It will move straight up to the effector organs. Now, let's talk about the hypothalamus and the pituitary gland. What is the relationship between the two of them? I want us to learn to be able to describe the anatomical relationship between the two of them and to distinguish them properly, especially in terms of the physiology. Remember, anatomy is location, 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 and physiology is function, function, function. A lot of your question is coming from the hypothalamus. I'm going to spend some time here, all right? Now, the hypothalamus, in terms of description, know that it's just like a funnel, flattened funnel, all right? Just flattened funnel. Now, it forms floor and walls of the third ventricle of the brain. We were going to discuss this when we are talking about the neuro, and also it regulates the primitive functions like in terms of water balance, thermoregulation, sex drive, childbirth. A lot of things is done by the hypothalamus, which we are also going to discuss. So many of these functions, know that they are carried out by the pituitary gland. That is how important the pituitary gland is to the hypothalamus. Both of them have, sine qua non relationship, if I have to put it that way. In terms of location, the hypothalamus is housed in a sella turcica of the sphenoid bone, all right? Know that, And also the size is just like a kidney bean. It's connected to the pituitary through the infundibulum, composed of the anterior and the posterior. So the anterior part is known as the adenohypophysis. The posterior part is known as neurohypophysis. So in this discussion, anytime I mention adenohypophysis, know I'm talking about anterior, A for apple, adenohypophysis, anterior pituitary, neurohypophysis, posterior pituitary, all right? So if you look properly at the diagram, you will see this is the anterior adenohypophysis, the anterior, and this is the lighter one is the posterior hypophysis. It's at the posterior region. So the two of them are the pituitary gland, and this is the infundibulum connecting it to the hypothalamus. Very important for you to know this. Now, the beautiful thing about the adenohypophysis is that it produces its own hormone. That's what I want you to know. Now, how does it do this? It do this by stimulation from the hypothalamus. The hypothalamus usually releasing hormone, which it sends to the pituitary, and the anterior pituitary now produces the stimulating hormones. All right? How does it send this? Through the portal system. Now, if you look closely, you will see those hormones that are produced by the anterior pituitary, including the follicle stimulating hormone, the luteinizing hormone, thyroid stimulating hormone, the adrenocorticotropic hormone, and the prolactin and growth hormone. These hormones are produced in the anterior. Now, how are they produced? They are produced by being stimulated by the hormones from the hypothalamus. What are the hormones that stimulate these anterior hormones? They include gonadotropin releasing hormones. So all the releasing hormones are from the hypothalamus. Know that. So in case of they give you an exam and give you releasing hormone, you know that when they're talking about releasing hormone, they're talking about hormones from the hypothalamus. But when they're talking about stimulating hormone, they're talking about hormones in the anterior pituitary. I need you to get this fact because it confuses many people a lot. It actually confused me then in medical school, for real. That's why I'm taking it easy so that I don't make a mistake on this, right? So you need to know the anterior hormones and the hypothalamic hormones. The hypothalamic hormones stimulate or trigger the release of the anterior hormones. All right. Now, those hormones are on the slide as you can see it right now. Now, when you are talking about the posterior pituitary does not really produce a hormone, right? Instead, the nerve cell bodies in the hypothalamus, they pass down the stalk, you understand, forming the hypothalamo-hypophyseal tract, and they end in the posterior lobe. So that hypothalamic neurons now secrete hormones that are stored in the neurohypophysis until released into the blood. So the neurohypophysis, that's the posterior, actually stores, not produce. It stores. The anterior produces, triggered by the hormones from the hypothalamus. But this time, hormones are produced in the hypothalamus and stored in the posterior pituitary. I need you to be able to differentiate that. Now, those hormones that are produced by those nerve cells from the hypothalamus into the posterior pituitary are two. They are usually two, which is oxytocin and antidiuretic hormone. Oxytocin and antidiuretic hormone. If you look at the diagram very well, you see the both of them, then you will see the stalk where they came from. So this shows you that they are produced here and stored here. All right? Which is completely different from the adenohypophysis. Very important for you to know this information. So in total, there are about 8 hormones produced in the hypothalamus, correct? 6 of them regulate the anterior pituitary, while 2 are released into the capillaries in the posterior pituitary. All right? So the 6 releasing and inhibiting hormones stimulate or inhibit the anterior pituitary. What are they? We have the thyroid releasing hormone, we have the corticotropic releasing hormone, gonadotropic releasing hormone, and also growth hormone releasing hormone. These 4 are releasing hormones that promote anterior pituitary secretion of thyroid stimulatory hormone, prolactin, adrenocorticotropic hormone, follicle stimulating hormone, luteinizing hormone, and growth hormone. So 4 of these stimulates 6 of these. All right? So the remaining 2 are the prolactin inhibiting hormone and also the prolactin, and also rather the somatostatin. Now the PIH, that is prolactin inhibiting hormone, inhibits the secretion of prolactin, while the somatostatin inhibits the secretion of growth hormone and thyroid stimulating hormone by the anterior pituitary. All right? So you need to know these 6 that regulates the anterior pituitary. 6 of them. TRH, CRH, GnRH, GHRH, and also the PIH and somatostatin. 6 of them regulates what? The anterior pituitary. 6 of them regulates the anterior pituitary. While the remaining 2, that is oxytocin and vasopressin, that's antidiuretic hormone, the 2 of them, what they usually do is that they are stored in the posterior hypophysis. They don't regulate the pituitary. They are just stored in the pituitary. Now, they may ask you, which part of the hypothalamus produces those 2 posterior hormones? The paraventricular nuclei of the hypothalamus produces the oxytocin. Let me tell you how you remember this then. Para. In Nigeria, para is when you are angry. Anger. That's paraing. Why are you paraing? All right? Oxytocin, that hormone is actually a paraing hormone. What does it do? It contracts everything. Press the breast, press the uterus, usually leading to birth pangs. So it's a para hormone. So if you remember para, oh, oxytocin is a para hormone, so paraventricular. Simple. And you're now left with supraoptic nuclei, which produces antidiuretic hormone. Remember, they may ask you, posterior pituitary synthesizes these hormones. True or false? False. All right? So now let's talk about the pituitary, because these are also the major organ of the hypothalamus, of the endocrine system rather. Now, pituitary, now we are done with hypothalamus, all right? We are done with the 8 hormones of the hypothalamus. Now let's talk about the 6 hormones of the pituitary. The first one is follicle stimulating hormone, also the luteinizing hormone. These are 2 gonadotropin hormones. What do they target? The gonads. They go straight to the gonads. Follicle stimulating hormone, what does it do? It stimulates the secretion of ovarian sex hormones, meaning that it helps to develop for the development of ovarian follicles and also for sperm production. That's follicle stimulating hormone. Luteinizing hormone specifically stimulates ovulation. That's why if you watch my video on a reproduction, which I will advise you to go and watch, you will see how the luteinizing hormone shoots up during ovulation. It's actually an ovulatory hormone. Also, other things it does is that it stimulates corpus luteum or pregnancy to secrete progesterone so that the pregnancy can hold. And also, it stimulates testes to secrete testosterone. We have discussed two: follicle stimulating hormone and luteinizing hormone. The third one is the thyroid stimulating hormone, TSH. What do you do? Stimulate secretion of thyroid hormone. Stimulate secretion of thyroid hormone. Now, another one is the adrenocorticotropic hormone. What does he do? It stimulates adrenal cortex to secrete what? Glucocorticoids. Another one is prolactin. What does he do? Prolactin helps to produce breast milk. I also discussed it in my reproduction. Please go and watch the video. Now, it has growth hormone, which stimulates mitosis and cellular differentiation. Very important for you to know this. Now, if you look at this diagram properly, you will be able to see everything we've discussed, the ones that stimulating which. All right? So if you look at it very well, you see this is the hypothalamus, this is the pituitary, this is the anterior, this is the posterior. These are the hormones that are produced in the anterior. These are the target organs. All of them are the target organs. You need to do this at your leisure, all right? I have to move. I don't want this video to be longer than it should be. Another two hormones that we should discuss about is the ones that are produced in the hypothalamus and transported to the posterior lobe of the pituitary. The first one is ADH, antidiuretic hormone. ADH, antidiuretic hormone. What does it do? It increases water retention, right? It forms an aquaporin pores, and thereby increasing the amount of water that is retained in the urine, so that you don't be dehydrated. So this is usually, increased or produced when there is dehydration. Another name for it is vasopressin. They will ask you this question in exam. One of your exam questions is, another name for antidiuretic hormone is vasopressin. Why? Because it can cause vasoconstriction. Vasopressin. It can cause vasoconstriction. I just want to illustrated that so that you'll be able to understand what I'm talking about. Now, the second hormone is the oxytocin. What does oxytocin do? I've explained it. Oxytocin is a para-hormone. It's always paraing, produced in the paraventricular nucleus. All right? It's, number one, helps to increase sexual arousal and orgasm. It is oxytocin that helps in sexual arousal and orgasm. For real. For real. Also, it promotes feelings of sexual satisfaction and emotional bonding between two partners. It stimulates labor contraction. That's the one we always remember. Labor pangs, pain. So oxytocin will press, and keep pressing until the baby pushes out through the vagina. Right? So it also helps to press out breast milk. Oxytocin is very, very important. Extremely important. When you are talking about control of pituitary secretion, there are three major controls. One is rate of secretion, usually not constant. All right? So sometimes, the brain can stop giving out, releasing hormones. So stimulatory hormones will not be produced. And also, another one is hypothalamic and cerebral control. You understand? These things can control the pituitary. Another one is when you are talking about the negative feedback, all right, which we are still going to discuss more. Usually, negative feedback is talking about increased target organ hormone levels, inhibiting the release of hypothalamic and pituitary hormones. So if the hormone has been produced enough, it will go back and inhibit these two from acting. That's what it means. That's meaning of negative feedback. For example, thyroid hormone, when it's produced enough, it can inhibit the release of TRH. How does it do that? It does that by inhibiting the hypothalamus, all right? And also the pituitary, stopping the TSH by the pituitary. This is just an example. But I need you to know these three regulations because that's something they can ask you in your exam. Now, I want you to look at this picture properly so that this is a very good example of a feedback, right? You see, this is the hypothalamus produces sense to the anterior pituitary targets this organ, the thymus targets this organ to produce the thyroid, produces thyroid hormone. When this thyroid hormone has gone to the target, what happens? More thyroid hormone produced will cause the inhibition of the anterior pituitary and also with inhibition of what? The hypothalamus. This is what we call negative feedback. This is what we call negative feedback. So thyroid releasing hormone, thyroid stimulating hormone, thyroid is produced, goes to the target organ, stop these two from producing this and this. Really simple. This is negative feedback. But when you're talking about positive feedback is usually when that substance is being released, it costs more of the action. For example, when it's being released during pregnancy, it will cost more oxytocin to be produced. That's positive feedback. For growth hormone have a lot of effects, It causes cartilage, bone, muscles, and fats to increase. It induces liver to produce growth stimulants like insulin-like growth factors, even somatotidins. All right. So we are going to discuss the actions of all these things, but it's usually to promote action of growth hormone. Everything is all about promoting growth hormone. Another thing growth hormone does is to induce liver to produce other stimulants such as protein synthesis, lipid metabolism, carbohydrates, electrolyte balance promotion. All right. Now, another good hormone that we need to talk about briefly is the pineal gland. Pineal gland is very important during puberty, and also it helps to synthesize melatonin. What does melatonin do? Melatonin helps you to maintain your circadian rhythm properly, helps you to sleep at night. That's why if you go to the hospital and you are not sleeping, oh, okay, fine, I can just give you melatonin to supplement the one your brain is producing. Maybe the pineal gland is not producing enough. Usually, when there is no melatonin, it leads to seasonal affective disorder, sometimes which usually occur in the winter. Also, symptoms like depression, sleeplessness, irritability, like you are so anxious. All these things is as a result of pineal deficiency, pineal hormone deficiency. Now, another organ we want to talk about, if you look at the diagram, is the thymus. The thymus plays a role in three systems: the endocrine, the lymphatic, the immune. So it's a very important organ. If you look at it very well, this is thymus in infants, this is thymus in the adults. You see the difference, large, little. What does thymus usually do? It secretes hormones like thymolene, like thymosin. They don't usually ask this on your exams, board exams. I hardly see any of them, especially on your college exams. But just know that thymus is very important, and it plays a role in three systems, very unique: the endocrine system, the lymphatic system, and the immune system. Now, another big organ is the thyroid gland. It's the largest gland that is purely endocrine, for real, purely endocrine. It's simple cuboidal epithelium that lines the follicles. Very, very important for us to know this. What does it secrete? It secretes thyroxine, that's T4. All right? I'm not going to go into thyroid hormone secretion, something you should go and read up at your leisure. But know that the thyroxine increases the metabolic rate, increases oxygen consumption, heat production, even appetite growth, a lot of things, alertness, reflex speed. Like somebody that have high thyroxine in the body, the person is always hyperthyroidism. If you have low, you are always depressed, quiet, just eating. That is hypo. All right? So it's very, very important. Now, there's something we call parafollicular cells. That's the C or clear cells. What this thing does is to secrete calcitonin with rising blood calcium. So it stimulates osteoblast activity, and bone formation, especially in children. All right? So these parafollicular cells are cells that are found in the thyroid organ or thyroid gland. Very, very important for you to know this. Another important organ is the parathyroid gland, rather. So parathyroid, if you look at it on the diagram, you see that it's 1, 2, 3, 4, usually 4 little glands that are embedded in the posterior surface of the thyroid. This is thyroid. These are the 4 of them embedded in the posterior. The question is, what do they do? PTH, parathyroid hormone, potassium tracing hormone. It pushes potassium out to bring in calcium. Always put that in your head. Pushes potassium out to bring in calcium. So potassium tracing hormone, PT. So what does it do? It increases blood calcium. So every other thing about it is talking about anything that happens when calcium is increased. Like what? Increase in synthesis of calcium, increases absorption of calcium. Okay, we've discussed that. But it decreases urinary excretion and also increases bone reabsorption. Very important. So I need you to look very properly at the parathyroid hormone and be able to understand it properly. Just behind. Look at it behind. They look at the esophagus just a little below. Now, another beautiful hormone is the adrenal hormone, or rather the adrenal gland. Now, this adrenal gland is just found, a little above the kidney. If you look at it very, this is the kidney, this is the adrenal gland. All right. Now, if you cut up the adrenal gland, bring it bigger, enlarge it bigger, you see it has the cortex, the outer cortex and the inner medulla. So when we cut the cortex and the medulla, more, you will understand what I'm talking about. This is the diagram. It has the zona glomerulosa. For the cortex, it has zona glomerulosa, zona fasciculata, and zona reticularis, GFR. Then this is the medulla. Now, the medulla specifically secretes the catecholamines. What does catecholamine do? It does a lot of things. It increases alertness, prepare body for physical activities. Go and read it up. Another thing is that it decreases digestion and urine production. You understand? And it increases blood pressure, heart rate, blood flow, and all those things. This is the function of catecholamine. And this catecholamine is produced in the adrenal medulla. They will ask you, they may not ask you all these functions, but they may ask you, what does adrenal medulla produce? Or they will draw the diagram of the adrenal medulla and point to it and tell you what does it produce. You have to answer correctly. All right. Now, for the adrenal cortex, we have the zona glomerulosa, fasciculata, and reticularis. All of them have their own secretions. The glomerulosa produces the mineralocorticoids, which helps to regulate the body electrolyte balance, minerals in the body. That's mineralocorticoids. That's good. The middle one is the fasciculata. Now, the fasciculata, it secretes glucocorticoids and androgens. While the reticularis also produces the glucocorticoids and the sex steroids. Very important for you to know which produces which. Now, when we go deeper, the mineralocorticoids from the glomerulosa, steroid hormones that regulates electrolyte balance, aldosterone specifically, that stimulates sodium retention and potassium excretion. Aldosterone, sodium retention, potassium excretion. You have to know this because this is also in connection with the urinary system. Extremely important. Now, when you're talking about the glucocorticoids, you're talking about regulation of glucose. Sure, from the name, glucocorticoids, glucocorticoids, glucose, cortisol, gluco and cortisol. All right. So it regulates metabolism of glucose and other fuels. Cortisol, corticosteroid stimulates fat and protein catabolism, and also they help the body to adapt during stress and repair tissues. They serve as an anti-inflammatory. Very important. Now we have the sex steroid, estradiol, androgens, for libido and all those things. You really need to go and look at that later. All right? Very, very important. Now, this is the pancreas. If you look at the pancreas very properly, it has what you really need to know here is the cells of the pancreas. The alpha, the beta cells, and the delta cells. What do they produce? Alpha cells produces glucagon. What does glucagon do? Glucagon is actually released between meals when blood glucose concentration is falling. You understand? So if you are fasting, it helps to bring back the glucose level by converting the glycogen back to glucose. All right? Also stimulates glyconeogenesis, and all those things. Sorry, glycogenolysis, not glyconeogenesis. Glycogenolysis and gluconeogenesis. Very, very important. Now, that is for glucagon. So remember, alpha cells, glucagon. Alpha cells, glucagon. What about beta cells? Insulin. Just opposite of glucagon. What does insulin do? Insulin helps to break down sugar. So when you are eating food, there's a lot of insulin produced to break down that sugar. And when there's absence of insulin in the body, it leads to type 1 diabetes. When there are insulin, but there are absence of receptors or enough receptors or inflamed the receptors, type 2 diabetes. Now, the delta produces the somatostatin. What does somatostatin do? It helps to suppress secretion of glucagon and insulin. It inhibits nutrient digestion and absorption, which prolongs absorption of nutrients. All right? So these are just the major things. So if you know that alpha produces glucagon, beta produces insulin, delta produces somatostatin, you are good. And somatostatin is always inhibitory. Now, some of the other organs that we can talk about is the gonads. All right? The gonads, you have the ovaries, for example, and testes. The ovaries, we discussed it at length when we discussed the reproductive system, which I really want you to go back to and look at that video. All right? Now, the ovaries and the testes, they produce endocrine products like raw eggs and sperms. Also, there are some hormones like usually steroid. Ovaries specifically produce estradiol, progesterone, inhibin. These are hormones. The testes produces testosterone. All right? And also some weaker androgen, even inhibin and estrogen. Very, very important for you to know. Now, there are some other organs that have endocrine functions, like the skin. Skin, it has keratinocytes, which converts a cholesterol-like steroid into cholecalciferol. using the UV. You understand? From the sunlight. So the skin actually has endocrine function. Same thing with the liver. You understand? The liver has about 5 hormones. For example, the liver converts cholic acid into cholic acid. Also, it produces secretes angiotensinogen. If you remember when I discussed the urinary, if you haven't seen that video, please go and see the video. We discussed about angiotensinogen, a prohormone. You understand? It is a precursor for angiotensin 2, which regulates blood pressure. It is the liver that produces it. Also, erythropoietin, which stimulates bone marrow to produce blood. Also, it's a source of insulin growth factor 1 that controls growth hormone. Also, there's hepcidin, which promotes intestinal absorption of iron. Without this hormone, you cannot absorb iron. You become iron deficient. Before you know it, you become anemic. Sure, this is one of the sources of iron deficiency anemia. We are going to discuss this later when we are talking about blood. Also, think about the kidney. It plays a very big role in production of 3 hormones. For example, converts cannabidiol to calcitrol, which is active form of vitamin D. And this vitamin D, remember, it helps to increase calcium absorption by the intestine. All right? Also, it's the kidney, apart from the cannabidiol, it secretes renin. And renin converts angiotensinogen to what? Angiotensin 1. Angiotensinogen produced by the liver to angiotensin 1. Before the lungs, producing angiotensin converting enzyme to produce the angiotensin 2, which is the active form. All right. Also, the kidney produces about 85% of erythropoietin. Liver produces just 15%. Kidney takes care of the others. So the kidney has 4 roles to play in endocrinology. The liver has 5. You need to know which are for the liver, which are for the kidney, because they will ask you. These are the exact questions they will most likely ask you. The heart also has its own function. How? The heart secretes, the arterial muscles of the heart, they secrete something we call nitritic peptide, which helps to drop blood pressure when blood pressure is increased. It's just a response mechanism. All right? Lowering blood pressure, as we've discussed. The stomach, the intestine, they produce a lot of about 10 enteric hormones, like, cholecystokinin, gastrin, ghrelin, hunger. Your tummy is doing grr, grr. That's hunger hormone. All right? Then we have the peptide, a lot of them. Even the adipose tissue produces leptin. Leptin makes you thin. Leptin makes you thin. Leptin makes you thin. Remember, even the placenta also secretes estrogen and progesterone. You have to know this. Now, the final thing I want to discuss is the 3 chemicals, the classes of hormone. That's in terms of chemistry. We have the steroid, we have the monoamines, we have the peptide hormones. Right? Steroids are derived from cholesterol, rather, usually sex steroids, such as estrogen, from the gonads. Also, we have the monoamines, which are biogenic amines, all right, like catecholamines, like melatonin, like thyroid hormone. These are monoamines. In case of they ask you, which are steroid hormone in this example? Steroid hormone in this example, remember the ones that are produced from the gonads and also the corticosteroid. Which monoamines in this example? Remember catecholamine. And catecholamine involves the dopamine, the epinephrine, the norepinephrine. Then we have the melatonin and the thyroid hormone. Very, very important. All right. Also, we have the peptide hormones and glycoproteins. All right. These ones are usually amino acids, specific amino acids, and they are hormones produced from both the lobes of the pituitary and the releasing and inhibiting hormones from the hypothalamus. So all those hormones we discuss are peptide hormones. All those hormones I would discuss are peptide hormones. So remember, steroid hormones, the examples, gonads, corticosteroid. Remember the monoamines, catecholamines, right? Then remember the peptides, which are all those hormones that we discussed. The hypothalamus hormone, the pituitary hormones. Very important. Insulin is also a very large peptide hormone. They're always very large. Peptides. From the sound of the name, peptides. Now let's talk about hormonal secretion. Finally, hormonal secretion, there are 3 mechanisms: the neural stimuli, the hormonal stimuli, and also the humoral. The neural, hormonal, and humoral. 3 of them. All right? When you're talking about neural, you're talking about from the nerve fibers. You understand that supplies the endocrine glands and elicit release of their hormones. Right? We have the sympathetic nervous system, which stimulates the adrenal medulla to secrete epinephrine and norepinephrine in a situation of stress. These are neural control. from the brain. Now we have hormonal stimuli. Hormonal stimuli is talking about from the hypothalamus that regulates the secretion by the anterior pituitary. So pituitary hormones, they listen to the hypothalamus. All right, the pituitary system listen to the hypothalamus. So that's hormonal stimuli. Why the third one is humoral stimuli. This is humoral, blood-borne stimuli. Blood-borne. So when there's rising blood glucose concentration, it stimulates the release of insulin. That's an example of humoral. You need to know these examples properly. Also, we want to discuss hormone receptors and mode of action because I found out that there are a lot of questions on this from the exam. All right. Now, receptors are protein or glycoprotein molecules. Usually, hormone come and stimulate these receptors, and the receptors act. So receptors act like switches, turning on metabolic pathways when hormone binds to them. So immediately hormone binds to them, they just start acting up, if I have to call it that. So receptor is very important. The receptor hormone interaction is very, very important, and it's very specific. So specific receptor for a specific hormone. When there are a lot of hormone on a particular receptor, it becomes saturated. Hormones like peptide hormones and catecholamines, they cannot penetrate target cells. What do? They bind to the surface receptors and activate intracellular processes through second messenger. Bear in mind, because they will ask you, how does this hormone function? They will give you an example of the hormone. Oh, you see that this is the hormone from the hypothalamus, maybe the prolactin, for example. From the pituitary, maybe prolactin, for example. Oh, prolactin. If it is from pituitary or from the hypothalamus, then it's definitely a peptide hormone, correct? Okay, so how does it work? It binds to the surface of the receptor. This is the surface. It binds to the surface of the receptor, and immediately there is an activation of the intracellular processes through a second messenger inside, and it starts functioning. That's how it works. But if you're talking about steroid hormone, remember steroid hormone? Steroid hormone from the gonads and also corticosteroid, right? Steroid hormone and thyroid hormone, specifically, steroid hormone and thyroid hormone, what do? They penetrate the plasma membrane. They go inside to bind to their receptor. So their receptor is internal. But peptides and catecholamines, their receptor is not internal. Instead, it's the surface. So when it binds, it now starts functioning internally. But this one is the steroid and thyroid hormone will enter inside to act. I need you to know the differences in these things. Also, there's something we call signal amplification, which is usually when there is a small stimulus, hormone is produced. Before you know it, it produces CAMP and protein kinase, which leads to activation of enzymes, leading to metabolic effects. Sorry, I speak too fast. This metabolic effect will lead to a great effect, all right? Leading to modulation of target cell sensitivity and a lot of things. Sometimes upregulation, sometimes downregulation. You know that upregulation means the number of receptors is increased, leading to higher sensitivity, while downregulation means that the number of receptors is decreased, lower sensitivity. Very important for you to understand the modulation of target cell sensitivity. Very, very, very important. And also for you to understand hormone synergism, that is hormone interaction. Now, finally, let me conclude with the disorders, all right? So there are a lot of disorders. There is hyposecretion, which is inadequate hormone secretion. Can be caused by anything. One of them can usually be tumor or lesion destroys a gland or interferes with its ability to receive signals from another gland. Maybe head trauma, maybe antibodies. I'm not discussing pathology, so I'm just trying to touch it the surface. Remember, anatomy is location. Physiology is what? Function. Most of your questions for anatomy and physiology will not come from pathology. When you get to the level of pathology, you understand better. But know that there's hyposecretion. And things that could lead to hyposecretion is head trauma, autoantibiotics and antibodies. They can degrade the target cell and, nothing will happen. Now we have hypersecretion. That's excessive hormone release. Also, tumors can lead to it. Autoimmune disorders. For example, the toxic goiter. That's Graves' disease. It's an autoantibodies that mimic the effect of TSH that leads to thyroid, hypersecretion. In terms of tumor, we have a pheochromocytoma rather. You understand? This is a tumor of the adrenal medulla that secretes excessive epinephrine and norepinephrine. This is a disorder, serious disorder. Now, let's give an example of some of those disorders. When you're talking about the pituitary disorder, we have the hypersecretion of growth hormone leading to acromegaly. All right? If it's an adult, acromegaly. If it's in children, gigantism. You see their hands long. All right? You need to go look at the diagram. For the thyroid, we have congenital hypothyroidism, we have myasthenia, we have goiter. Myasthenia is usually when it happens to adults. Adult hypothyroidism. That's myasthenia. That's decreased thyroid hormone. When you talk about congenital hypothyroidism, it's usually present at birth. That's when there is low thyroid at birth. You understand? Usually, we treat these children by giving them oral thyroid hormone. That's why if a child is born, we're always testing for thyroid hormone to make sure it's sufficient. If not, the child can have brain damage. We also have goiter, which is the enlargement of thyroid gland. Endemic goiter. Very, very important for you to be able to recognize it in the exam. We also have hypothyroidism. You understand? Hyperthyroidism, when you're talking about thyroid and parathyroid disorders. We have adrenal disorders like Cushing syndrome. Cushing syndrome is usually excessive production of, right? It leads to hyperglycemia, rapid muscle and bone loss, abnormal fat deposition, and all those things. Then we have AGS, which I've discussed initially, which is the adrenogenital syndrome. Very, very important for you to understand. Adrenogenital syndrome is usually enlargement of the external sex organs in children. Very, very important for you to know. Cushing syndrome, you should be able to recognize their moon phase. Now we have diabetes mellitus, usually very prevalent in our world today. One of the most prevalent metabolic disorders. I've discussed it initially, but it's as a result of disruption of metabolism due to hyposecretion or inaction of insulin. You see, especially type 1 and type 2. You understand? You see the patients having polyuria, polyphagia, polydipsia. Polyuria, excess urine. Polyphagia, excess consumption of food. Polydipsia, excess tests. Type 1, usually children. 5% to 10% of cases in the US. All right? Insulin is always used to treat. Why? Because they don't produce enough insulin. Why type 2, they produce enough insulin, but the problem is insulin resistance, failure of target cells to respond to insulin. So we don't need to give insulin. Instead, we need to give drugs that can mimic those target cells' response. Usually, the pathogenesis mechanism of action is cells cannot respond to and cannot absorb glucose. You understand? So that's just the pathology. So sometimes they rely on fats and proteins for energy needs, thus leading to weight loss and weakness. But I'm not discussing pathology, for real. I'm not discussing pathology. I have just been able to describe about 100 questions. So I need you to go back, look at everything I've discussed, one after the other. I was very, very specific. Now, I will still point out about another 80 questions for you to be able to understand for you to be able to understand properly. Remember, as a recap, this is a summary. How do you describe a hormone? Tell them that a hormone is a chemical messenger that is transported by the bloodstream that stimulates target cells in another organ, often at a very low distance. It's a chemical messenger. And it does not diffuse in a point of origin locally. No, that is paracrine. Hormones go a long distance. So look for the option that has that long distance in it. All right? Now, hormones, do they serve as intracellular messengers? No, they don't. Instead, they usually rest on their target, on their receptors, and their receptors will not trigger the second intracellular messenger. All right? Remember the endocrine organs. Remember the endocrine organs that we discussed. The pineal gland, the thymus, hypophysis, that's the neurohypophysis, that's the posterior, and the adenohypophysis, that's the pituitary. The testes, that's the gonads. All right? So if they give you a list, look for the one that is not or for the one that is. It depends on what they're asking you in your exam. Also, we discussed that the pineal gland, you understand, it's usually found as part of the epithalamus. So you should also bear that in mind. And I also wanted to mention that endocrine glands release their secretion into the blood, not through ducts, into the blood. I want you to underline this, write it down. All right? Now, when they're asking you about vasopressin, you know it's an antidiuretic hormone. I've discussed this initially. All right? You need to go and know all the abbreviations of those hormones. Know them. Also, the nervous system reacts to stimuli very fast. Very fast. Quickly. Endocrine system is always slow. The nervous system also adapts quickly. It's also very specific, unlike the endocrine system. So everything about the nervous system compared to the endocrine system is fast. Remember that. Just remember that. We discussed receptor. I discussed that at length. That is what a cell uses for responsiveness to a particular hormone. I discussed it well. Another thing I mentioned is the hypophyseal portal system. What did I tell you that it connects? It connects the anterior pituitary to the hypothalamus. But when you're talking about the posterior, you're talking about the stalk. The stalk. That's when you are talking about the posterior. But the anterior is hypophyseal portal system, anterior pituitary. Don't mistake these two. And I mentioned something about infundibulum. I told you that infundibulum is the projection of the hypothalamus from which the pituitary gland hangs. So infundibulum has to do with the pituitary gland as a whole and the hypothalamus. But when you are talking about the hypophyseal portal system, that is the anterior. When you're talking about the stalk, that is the posterior. What secretes growth hormone? Well, we know it's anterior pituitary. So know what anterior pituitary secretes and posterior pituitary secretes. And know that the anterior pituitary is always larger than the posterior pituitary. It has nothing neuronal. Nothing neuronal. It produces its own hormones, unlike the posterior pituitary. Very, very important for you to note that. When we were discussing about tumors, I told you that tumors can cause hyposecretion and hypersecretion. You have to bear that in mind. You understand? That's one of the the disorders in the endocrine system. We mentioned the diabetes insipidus and diabetes mellitus. Please, insipidus deals with water. Mellitus deals with sugar. Insipidus deals with water. And what causes water? What deals with water that I discussed? The antidiuretic hormone. So diabetes insipidus is caused by the hyposecretion of antidiuretic hormone. Why? Because antidiuretic hormone does what? It retains water. So when somebody has diabetes insipidus, the person is pouring out water. Her antidiuretic hormone is having an issue. So it's hyposecretion of antidiuretic hormone that causes diabetes insipidus. I am repeating it a lot of times. What are the hormones released by the posterior pituitary? I mentioned oxytocin. I mentioned vasopressin. Another antidiuretic hormone is what? Vasopressin. Remember that. What are the hypothalamic hormones? Go and learn it. I mentioned it. Antidiuretic hormone, thyrotropin releasing hormone, somatostatin, prolactin inhibiting hormone. All these things I mentioned 8 of them. 6 activates the anterior pituitary, while 2 is stored in the posterior pituitary. Go and look at them. If you don't even remember them, at least remember that releasing hormone are coming from the hypothalamus. All right? Extremely important. Also know if they ask you what does antidiuretic hormone target, it is the kidney. Think about it. It's rational. Antidiuretic hormone, another name for it is vasopressin. Vasopressin. All right? And I told you that antidiuretic hormone, diuretic water, urine. What produces urine? Kidney. Simple. Just as simple as that. All right? Now, you should know the hormones that stimulate which hormone. So which hormone from the brain, from the hypothalamus, stimulates glucocorticoid secretion? Or from the pituitary? That's when you're talking about ACTH. Always bear that in mind. Adenocorticotropic hormone, ACTH. Also, there's a question that they may ask you, which of the following hormones does not stimulate the release of another hormone by its target organ, cell? All right? When you're talking about stimulating another hormone, prolactin, does it stimulate anything? No. It just presses everything. It just produces milk, like in the breast. Just prolactin production, production, secreted in the anterior pituitary. So very, very important for you to note this. So remember, dehydration is sensed by the hypothalamus, and immediately antidiuretic hormone is activated in the posterior pituitary, and it goes to act on the kidney. So it is hypothalamus that detects dehydration, sends signal to have the posterior pituitary gland release antidiuretic hormone. I need you to have this in mind. And also, antidiuretic hormone acts on the kidney to increase water retention. I'm mentioning this thing 2 times because it's very important. It also acts to constrict blood vessels. That's why we call it vasopressin. Making emphasis on this. Another thing you need to know is the thyroid releasing hormone targets what? The anterior pituitary. Simple as that. Releasing hormone means that it comes from the brain, the hypothalamus. Where does any releasing hormone go straight to where? The anterior pituitary. I want you to be able to answer these questions this way. All right? Now, remember negative feedback and positive feedback. Remember the examples. I told you positive feedback is very rare. Usually oxytocin, maybe bleeding, also platelets clotting. All those are positive feedback. But when you're talking about negative feedback, you're talking about the normal feedback. Too much production leads to inhibition. I gave you an example with thyroid. All right? So that's another thing you need to bear in mind. Also, Think about oxytocin and antidiuretic hormone being produced in the hypothalamus by those nerve cells and stored where? In the posterior pituitary. Very, very important for you to know. I've discussed the hypothalamo-hypophyseal portal system. What does it connect? The anterior pituitary to what? The hypothalamus. They can tell you it connects the adenohypophysis. Yes, anterior pituitary is adenohypophysis. A. Growth hormone in adults, in children leads to what? Gigantism. Adults is what? Acromegaly. I told you this. Also, when they are asking you about target hormones, growth hormone targets a lot of things in the body. Bear that in mind. It targets a whole lot of things in the body. When you compare, if you see the diagram I showed you about the thymus, I showed you a diagram about the thymus of a child. Look at it. Look at the thymus of a child and the thymus of an adult. You see? It's very big in children, shrink in adults. Always bear that in mind in case of if it comes out in your exam. Bear that in mind. It shrinks in adults. All right? And about pancreas, remember the pancreas is located between the duodenum and the spleen, just a little below the stomach. Very, very important in endocrinology. Remember I told you the hormones of the cells of the pancreas, the alpha, the beta, and the delta. Remember what they produce? Glucagon, insulin, and what? Somato. Complete it. Put it in the comment section. Let me know if you will get this. Okay, let me ask you this question, and I'm not giving you the answer. I want you to put it in the comment section. Which cell in the parathyroid gland secretes parathyroid hormone? A. Basophil. B. Parafollicular cell. C. Chief cell. D. Chromaffin cells. Don't Google the answer. I want you to attempt it first before you Google it. I'm not going to give you the answer. Ask me in the comment section if you don't know it, or just put the answer in the comment section for me. All right. All right. Another thing about cortisol is that cortisol helps us to bear stress. Correct. Bear that in mind. And also it helps to promote breakdown of fat and protein. Extremely important. Can you remember the difference I gave you between type 1 and type 2 diabetes? I told you that type 1, insulin is not being produced enough. So insulin-dependent diabetes, correct? Lack or low level of insulin, that's type 1. But type 2, is it the same thing? No, not the same thing. Not the same thing. Type 2 is that insulin is being produced enough, sufficient quantity. But the problem is the receptors or the target cells are not recognizing it. Insensitivity. You have to bear this in mind because that's why I explained a little pathology. You know? Now, another question you may tend to meet is in terms of polyuria and dehydration. What happens? Which of the following is the correct sequence of events leading to polyuria and dehydration associated with diabetes mellitus? I told you something about diabetes mellitus that it leads to polyphagia, polyuria, polydipsia, correct? Of course. So it leads to hyperglycemia, correct? Hyperglycemia, high sugar, because there's a lot of sugar, nothing can break it down, or maybe insulin is not recognizing it, being recognized by the target cell to accept the sugar. So there's hyperglycemia. What happens? The glucose enters the renal tubes, which it should not enter. From there, the glucose transport maximum exceeds the normal sequence. It should enter, but not too much. Before you know it, a lot of glucose in the urine. What happens? It increases the osmolarity of the tubular fluid, leading to osmotic diuresis. Osmotic what? Diuresis. This is the sequence. Write it down. Look at it. Google it. Get more facts about what I just told you. Now, there's a hormone secreted by the pineal gland. Can you remember? Hormone secreted by the pineal gland. That hormone helps to regulate sleep. Melatonin. It's melatonin. Helps to regulate sleep. All right? Remember that. Very, very, very important. Also, bear in mind that the thymus secretes several hormones that stimulate the development of lymphatic organs and regulate development and activity of the T cells. Very, very important for you to know. The thyroid also secretes hormones that increases body metabolism. I discussed this. Quick reflexes, I discussed this. Remember, I'm just giving you a summary of everything I discussed. These are your questions. What did I tell you about the parathyroid hormone? Potassium tracing hormone. All right? So it releases a hormone as a result of hypocalcemia. When calcium is low in the body and potassium is high, what happens? Parathyroid gland releases a PTH immediately. And PTH does what? Pushes out potassium and recruits calcium, thereby increasing calcium. And calcium is very important in the body. All right? So Look at the question properly to know your. So the parathyroid hormone gland secretes hormone as a response to what? Hypocalcemia. Now, when they are talking about promotion of sodium and water retention, they are talking about aldosterone. What produces aldosterone? Adrenal cortex. Specifically, adrenal cortex. Don't say adrenal medulla. Adrenal what? Cortex. And remember, I gave you the three different zones. GFR. I call them GFR. Glomerulosa, fasciculata, and reticularis. What did I tell you about the fasciculata? It produces what? Produce what? Cortisol. All right? Cortisol. Now, when you finish eating after a meal, what happens? What does the pancreas do? Which gland, a cell in the pancreas has any effect after meal? So during meals, insulin is produced by the beta cells, correct? To break down glucose to glucagon. But many hours after a meal, alpha cells secrete in the pancreatic islet, secrete what? Glucagon. So whenever you see alpha, gluca, what does it do? What does it do? It raises blood glucose. So if I've not eaten for several hours, my alpha cells will just come into action. Oh, I need energy. I need ATP. So immediately the alpha cells will produce glucagon. Glucagon will do what? Convert the stored sugar in my body, that's glycogen, back to glucose. Oxygen reacts on glucose and leads to ATP. It's as simple as that. So I need you to be able to understand this because I discussed it initially. Parathyroid hormone, I told you, is everything calcium. It helps to reabsorption of calcium. Just anytime you see parathyroid hormone, just think about increasing calcium. But when you are increasing calcium, remember, increasing calcium in the urine will reduce calcium in the body. So we are talking about increasing calcium in the body, like reabsorbing calcium from bone. Very, very important. When you are talking about Cushing syndrome, a lot of things can cause Cushing syndrome. ACTH hypersecretion by the pituitary. ACTH secreting tumors can secrete a lot. Hyperactivity of the adrenal cortex, excess cortisol secretion. All these things can cause Cushing syndrome. All right? So you need to know what can cause Cushing syndrome so that you know what cannot cause it. Because in your exam, they can ask you which of these can cause Cushing syndrome, or they can ask you which one cannot. I'll mention it again. ACTH hypersecretion by pituitary, or by ACTH secreting tumors, or hyperactivity of the adrenal cortex, or excess cortisol secretion. These four things causes Cushing syndrome. When I was telling you about diabetes, what did I tell you about the characteristics? Polyphagia, polyuria, polydipsia, right? Now there's glycosuria because there are a lot of sugar in the urine. But somebody tell you hypoglycemia. Is it characteristic of diabetes? Hypoglycemia? No. Low. Nah. Sometimes hypoglycemia in diabetic patients can be as a result of the drug they took. Can crash the blood sugar, and person become hypoglycemic. So they are predisposed to it, but that's not symptom of it. Now, there are a lot of glands that are not endocrine glands, but they have role in endocrine system, like the liver, like the kidney, like the skin. All right? You need to differentiate the primary endocrine glands and the accessory. The primary, the pancreas, the thyroid, the parathyroid, the adrenal gland. All right? And others. But when you talk about the kidney, liver, skin, this, that, no, they are not. There are some organs that has both endocrine and exocrine functions, such as the ovary has an endocrine and the exocrine function. I told you initially. Steroid hormone. What did I tell you about steroid hormone? I told you there are always hormones that are produced by the gonads, and also the corticosterones, like the cortisol, progesterone, aldosterone, estradiol. They are steroid hormone. Insulin is not a steroid hormone. Bear that in mind. And also, I want you to have in mind that glucagon is synthesized in the rough endoplasmic reticulum. Very, very important. Very, extremely important. Which hormones are part of monoamines? I told you. Catecholamines, thyroid, right? T4, T3. They are monoamines. How do they do? What do they do? They are mostly transported by binding to the globulin. That's why we have TBG. Oh, I didn't mention it. Please, I'm telling you now. The transport mechanism of thyroid is by binding to globulin. That's why we call it TBG, thyroid binding globulin. So they are monoamines and they bind to TBG, to globulin rather. Now, they may ask you a question about which of the hormone acts directly on the genes. Estrogen, gene. So estrogen acts on genes. Remember it. That's just a formula. Remember it. Now, remember I discussed enzyme amplification for you, right? So enzyme amplification makes it possible for even a small quantity of hormone to have a very strong effect on a target cell. Enzyme amplification. And we also discussed about upregulation, right? Upregulation is an increase in the number of receptors making a target cell more sensitive to a hormone. We also discussed synergistic effect, all right? Synergistic effect, when you are talking about two hormones, you understand, working together to acting together, you understand, to have a better effect. That's synergistic effect. When we are talking about antagonistic effect, we are talking about opposite effects. For example, the glucagon and insulin, they act opposite of each other. You understand? That's antagonistic effect, you know? Example of synergistic effect is, I didn't mention it, follicle stimulating hormone and testosterone, they act together to produce sperm. All right? So remember the example of synergistic and remember the example of antagonistic. All right? Now we have circulating hormones, usually taken up and degraded by the liver and the kidney. Liver and kidney takes up hormone or degrade them. When you're adapting to stress, what is the stress hormone? Cortisol. Don't forget this. Cortisol. All right? Sometimes when you are exhausted stage of general adaptation, that's stress response, stress overwhelms the homeostasis. The major characteristics of this stage is that the energy demands are met primarily by protein metabolism. Protein will be breaking down, all right? Not fat. But the initial response to stress is called the alarm reaction, usually by the norepinephrine and epinephrine. Put this in mind. Alarm reaction. And remember that the paracrines are secreted by one into the tissue fluid. I told you this thing. Very close. Closed cells. Paracrine. Now, what is the role of prostaglandins? Induce labor contraction, constrict or dilate arterioles, vasodilation of vasoconstrictors, inhibit gastric secretion. These are the roles of prostaglandin. Any other thing outside this thing is foul. It's wrong. All right. And also know about something about, I didn't mention it, something about eicosanoids. Eicosanoids. They are derived from arachidonic acid. I don't want to go into it, honestly. I ran away from it. All right. And usually a lot of people in the US take aspirin and ibuprofen, pain. Remember, these two, they block the action of cyclooxygenase. That's how they block action of pain. All right. Usually, we recommend aspirin to be taken by elderly men to serve as a blood thinner. And we also recommend ibuprofen usually when people are having slight pains, like periodic pains. All right. Iodine is very important for thyroid. Very important, because with iodine, the thyroid is able to produce the T3, T4. Iodine is always the major content. All right. So if they ask you a question about absence of iodine, what does it lead to? Hypothyroidism. All right. Very, very important. So once again, I want to take you through these pictures. You look at them very well. Know what they produce. Know everything we discussed about them. This is the pineal gland. This is the hypothalamus. This is the pituitary gland. This is thymus. This is thyroid gland rather. This is thymus, shrinking in adults. This is the adrenal gland. This is pancreas. This is gonads. All right. You need to know these things properly. You need to also be able to know this in case of they label it for you. What are all these things? I don't know if you understand. Remember the hypophyseal. This is the hypophyseal artery. Remember these hormones coming from the hypothalamus, right? The releasing hormones. Remember these stimulating hormones. This one produced in the anterior pituitary. And remember the ones that are stored in the posterior pituitary, which I discussed with you. All right? You have to know which area is. This floor of the hypothalamus. This is the third ventricle. This is the nuclei. Remember, I told you paraventricular para produces oxytocin because it's a para hormone, parain. But the supraoptic nucleus produces what? Antidiuretic hormone. Another name for antidiuretic hormone is vasopressin. It is used for water retention. All right? To reduce the amount of water that's flowing out. And a problem with it leads to what? A problem with it leads to what? Diabetes what? Write it in the comment section. Write it in the comment section. Another thing you need to know is this is a stalk. All right? This is optic chiasma. Yeah, so those are very, very, very important. You need to know these diagrams in case of if they ask you. They will ask you, they will point to this and tell you what is this. If you trace this thing well, what does this thing tell you? This is the thyroid releasing hormone. You understand? It stimulates the release of TSH from the anterior pituitary and also prolactin. Prolactin acts on the breast TSH acts on the thyroid. These two are controlled by the thyroid releasing hormone. That's why this color is the same thing. Very important. Now look at the gonadotropin releasing hormone. What does it stimulate? It goes to the anterior pituitary and stimulates the gonadic hormones, which are the luteinizing hormone and follicle stimulating hormone, which are produced in the anterior pituitary. And the two of them act where? On the testes and on the ovary. Now, if you look very well, this is cortical CRH. This is CRH. This is corticotropic releasing hormone. What does it do? It activates ACTH, which is produced in the anterior pituitary and goes in the adrenal cortex to stimulate production. Now, this is the growth hormone releasing hormone here, which stimulates GH, growth hormone, acting on the liver and also acting on the muscles. In short, a widespread reaction. You need to know this. Go and know all these things, all these abbreviations, because they will point to them and tell you to explain, or they will ask you a question on them. Extremely important. Now, you need to know this. I told you initially, this is the hypothalamus, for example, producing the releasing hormone, thyroid releasing hormone. The anterior pituitary produces thyroid stimulating hormone, which goes to the thyroid. Now, this thyroid produces thyroid hormone, which goes to the target organ. When it is producing too much, what happens? There is an inhibitory effect, which there is the red one, which inhibits here and inhibits here. What is it called? Negative feedback. They will point the arrows to it and they will ask you. Very, very important. Same thing with this. The significance of this thing is that this is bigger in children and tiny in adults. All right? Very, very, that's the thymus. And the thymus has function in 3 places. I told you. Rewind the video so that you understand what I'm talking about. All right? Now, this is the follicular cells. What does the follicular cell produce? What does the parafollicular cells produce? Rewind the video back and you understand it. Write it down. This is one of your questions. Trust me. All right? Now, we have the parathyroid hormone. These are the 4 of them. They will label it and tell you what do they do. What is parathyroid hormone? PTH. PTH, potassium trashing hormone. It pushes potassium out. Why? Because it wants to bring calcium in. We want a lot of calcium in the body. It will even bring calcium that is in the bone, bring it out in the blood. We want to increase calcium in the blood. All right? Now, we also have the adrenal. They will point arrows to all these places. This is cortex, this is medulla. What does the medulla produce? You have to know. This adrenal medulla. This is zonal reticularis. They will tell you which zone is this. What does this reticularis produce? What does fasciculata produce? And what does glomerulosa produce? If you don't know this layer, you won't know what it produces. So this is GFR, glomerulosa, fasciculata, reticularis. G, then this is medulla. Finally, they will ask you this, all right? Remember the alpha cells, the beta cells, the delta cells. What does alpha produce? Alpha, glucose, beta, insulin, delta, somato, whatever. So the point I'm trying to make is you should go and look at all the diagrams. Use the atlas, use McGraw-Hill, learn all the diagrams. Because this is not an all-inclusive list. This is just some that I feel like bringing out to you. So for this, I wish you success in your exams. I know you are going to do well. Please make me proud. When you write your exam, I want you to come back here and leave a comment for me. Please, leave a comment for me. Please follow this channel, subscribe to this channel. Also, send the link to your friends in every college, whether in the US, outside the US, in Pakistan, in India, in Nigeria, anywhere, in the United Kingdom. This video is very relevant. This is a rapid review. There's nothing that we ask you on endocrinology that is not on this review. Nothing. But that does not substitute for your school books. That does not substitute for your lectures. No. But this is a rapid review. This is something I want you to look at in the night of your exam. Send it to everyone.